Our healthcare system is changing. One of the areas getting more attention is home health care.
Yeah, it's important for people who are homebound, have difficulty getting in and out of the house, or have a medical need like wound care.
CareOne Caregivers specializes in home health. And here today, registered nurses Deborah Swanson and Kim Shooter. Good to see you this morning.
Nice to have you here.
Glad to be
So there's
here.
a lot of
Thank you.
reasons why somebody would choose home health. Can give us a little rundown of those.
Okay. Well, home health, with the baby boomers getting older and people don't want to go to care facilities, they want to stay home. Home health is one way that they can stay home. They do better, they heal better if they're in familiar surroundings, and they can stay home. It also saves a lot of money because the cost savings of going to a facility or a hospital, if you can get the treatment at home.
And you can still get a high quality of care
Yes.
at home when nurses are coming to see you, just like the two of you do.
Yes, we have RNs on staff. We have a medical director, which, you know, it's a backup doctor. And if you don't have a doctor of your own, he'll make house calls.
On the screen right now, we're looking at sort of a rundown of some of your services. That's a lot, but that's not even the extent of it, I would guess, what you provide.
Because you have all the services of nursing, and we have to be able to do it at your house. You know, if for some reason you need 24/7 nursing care, then it's better to be maybe in a hospital. But as long as you can be home, we can come every day or at least every week. You know, it all depends on what the issues are.
Exactly.
And we have nurses, LPNs, we have CNAs that can help with baths and care. We've got the medical director. We also have physical therapy, occupational therapy, speech therapy. So we can supply all of that.
Meeting a lot of
Physical
needs.
therapy is huge, whether you're recovering from a knee replacement or whatever it is. It's just hard to get out. So to have somebody come to your home and provide some of those services is
and
critical.
Kim, what kind of difference are you making in people's lives? What do you see day to day?
Well, we're meeting a lot of families and getting out there and seeing how much families care about their loved ones, and it's nice to be able to care for them in a special way that their loved ones have cared for them for so long. So it's also nice to give family members a break. So they have time for themselves as well, and take care of themselves.
I mean, even if you've got all the love in the world, you might not have the knowledge to do some of this stuff, the education.
Being a caregiver, it's a tough job for anybody out there, and it's right in your name, CareOne Caregivers, so you can provide that service as well. But
the process is one of the things I want to make sure we get to, since we have you here, because I think a lot of people wonder, how do you initiate all of this, and what happened? So would you walk us through that?
Yes. CareOne Caregivers started in 2008, and he supplied staff to care facilities and CNAs to homes for baths and stuff. And then he decided to get into the home health and skilled nursing. And in order to do that, you have to have Joint Commission come and approve you so you can take Medicare clients. But it's kind of a catch-22 to be able to take the Medicare clients. You have to have clients on board. So we need 10 or 12 clients for free, because since we aren't Medicare approved yet, we can't charge. So right now we are offering free home health services to anyone that's homebound that needs a medical need or a skilled need, nursing need. So it's free. We don't charge insurance. We don't charge Medicare. We don't charge home private pay. We don't charge anything. It's all free, and there's no catch to it, because we need those free clients for Joint Commission to come and check us out, make sure all our binders, all our books, all our computer software, everything is correct and doing correct. And then we also need them to survey a couple of our clients to make sure the care is really beyond comparison. And
So then the patient
in order to do
wins
that,
in that,
they
in
do.
that regard, when you get
Because
free care,
there's
it
no,
makes sense.
no charge whatsoever.
Which communities do you serve? I mean, we're reaching areas, sort of, if you think about, a radius of an hour plus from Omaha.
Just about,
How
yeah.
far do you go?
About an hour around, anywhere around Omaha or Council Bluffs.
So does a doctor, if somebody has their family physician, is that who needs to call you, or can one of our viewers who, whether it's them or someone they love needs this care, can they initiate the process?
Yeah, the family calls the number that should be showing on the screen, and the family calls, and then we can visit with them, we can come to their house, we assess what the need is, and then we will check with their doctor, tell them what we see, perhaps a need, that we can help them. They are homebound, there is a need. So then we check with the doctor, as long as it's okay with the client. We do all that. The physician will order it, that we can go ahead and do the assessment. So then it's a hands-on blood pressure assessing, skin, and really visiting, make sure the client is on board with what we're doing, the doctor's on board. We make a plan of care, and everyone is okay with the plan of care.
Everything you're saying, it rings true to me, because as I shared with you before the show started, my mom works in home health care, and it takes so much heart to do what you guys do, and the amount of time that goes into it, it's incredible. The number, if you would like to see, if you could get care for free, it's 504-3219, and the website, which we were just looking at, it's CareOneCaregivers.com. But here in Omaha, gals who live and work here and taking care of families here, it's special, and we appreciate you coming in. Kim, nice to meet you.
You too.
Deborah, nice to have you here too.
Nice to be here.
Thank you.